Hey guys, thank you so much for stopping by my channel. My name is Shaznation. In this video, we're going to go through some resources I used to study for this NCLEX in order to pass with 60 questions. In order to pass, I think I engaged myself in meticulous studying that called for consistency, discipline, and just overall thoroughness. But just to kind of give you guys a timeline as to how I scheduled my exam date, I gave myself at least 3 months to thoroughly practice questions and also review content as much as I could before I scheduled my test date. So I scheduled out 3 months in time, scheduled my test date until I was able to finish reviewing all my resources. The good thing about scheduling out, you can always change your test date. Whenever you feel like you're not too ready to test, you can always reschedule, and whenever you feel like I am ready, I can do this, you can always reschedule to an earlier date as well. So as for me, month 1, I did use my Saunders book. So this book has at least 2,000 practice questions with rationales. And the way I used this book in month 1, I dedicated to do at least 25 questions a day to start it off. Then I gradually increased it to 50 questions daily before I could handle about 75 to even 265 questions. So I started with about 25 questions every day, gradually increased them to 50 questions a day, and as I am doing the questions, I would go back to them, review them, look at the ones I got wrong, and wrote the rationales down, and also just as a refresher on that particular content. So the first month passed. I finished going through all the 2,000 questions in my Saunders book, and as I am writing down the rationales, I am also referring to my ATI book. So this was the ATI book provided from my school. The good thing about this ATI book, it's kind of like the down and dirty version of instilling all the content areas that you need to know for the NCLEX. And to me, this was really helpful. Let's say I get a question on shock and I missed that. I will go back to my ATI book, read over about shock, and I will also log into my ATI program online and watched a couple videos. If I had trouble answering a question about skills, let's say inserting a nasogastric tube, I will go back to my ATI, log in, and watch the skills videos because they're very, very nice. I think that's what I really loved about ATI. Come month 2, I enrolled with Kaplan's refresher course. Now this course might have been my life-changing experience because I cannot explain how helpful these courses were. When you enroll with your program, the program has about 3 phases. So on each phase, you get an orientation on what to expect for under each phase. So the first exam you're going to do on the first phase is your CAT exam. The CAT exam is Kaplan's way of telling you this is how the NCLEX is going to be, and they truly mimic how the NCLEX is going to be. So when you take the CAT exam, it's just going to shut off just like the NCLEX after it determines that you're either competent or not competent. After the CAT exam, there's a diagnostic exam which has about 180 questions that you have to do just to gauge where you are from all the content areas. When I say content areas, I mean things like safety and control, health promotion, the 8 main categories in nursing. Then finally, you're going to have your question trainers. Now these question trainers are also additional questions that give you more insight on how you're doing on these content areas, on these 8 categories. After doing each set of questions, be it the CAT or the diagnostic exam, I was always setting the next day to reviewing the CAT exam. Let's say I did the CAT exam today, I'm going to have the next day to remediate all the questions and write the rationales down as well, just so I can better retain the information on what I missed and what I didn't. Under phase 1, you'll also find some essential nursing content. This was definitely very, very helpful. You can find this Kaplan book as an ebook, or you can also buy it on Amazon as a physical textbook. Personally, I like having the physical book because then I can highlight things like so, and that just helps me better remember and take my own personal notes inside the book. So inside this essential nursing content, you're going to find helpful videos as well. You're going to find the whole contents library that has a bunch of videos, almost 400 videos. Let's say you forgot about adrenal disorders. You can simply tap on the video, and what I like the most about these videos, they were not longer than 15 minutes. Other than that, you can also find pre-recorded videos or upcoming live session videos where an instructor goes live and they discuss content areas. It can be, for instance, sickle cell disease, whichever topic you want, they got it. So session 2 comes, there was also an orientation, and session 2 is where there's a live educator and they have about 7 sessions. So on day 1 you do at least session 1 and 2, day 2 you do session 3 and 4, day 3 you do session 5 and 6. Session 7 now gives you another set of questions for you to practice based on how you were taught by the educator to use the decision tree. I cannot explain how much this decision tree helped me. They teach you a formula on how to answer the NCLEX style questions. It shows you how to prioritize and delegate and so much more. I'm telling you guys, this program was worth it, because when you're taking the NCLEX, it's not about how much content you know, it's about how you answer the question. I got some questions I did not know what the hell they were talking about. To me, I was like, I have never heard about this. When you learn about the formula and the decision tree on how to answer the questions, I guarantee you can answer any question even if you do not know the content behind it. So after you do session 7, which was the NCLEX-RN test, they give you this test so that they can see how you're doing after you've known how to use the decision tree that they teach you under phase 2. And then the next day, or whichever day you're available, you can schedule with an educator to discuss about the roadmap success, where you remediate the 60 NCLEX-RN tests they give you right after finishing the live review. Under phase 3, of course, you're going to have your orientation, you're going to have your question trainers again, you're also going to have another CAT exam. They also added some NCLEX sample tests that focuses on how to answer alternate form questions like the select all that applies and who do you see first questions. NCLEX love these type of questions. They want to see, do you know how to prioritize your patients? Who are you going to see first? Who's the most critical? Who's stable at least? Who's the least critical? So they give you 4 NCLEX sample tests and 1 readiness test. You should take this about 1 week or 2 weeks before you test. The biggest takeaway from this phase, the phase 3, was the Q-Bank questions. You also have an additional 2,000 questions that you have to utilize before you can be ready to test. So the way I used this Q-Bank questions after finishing all the other components under phase 3 and just remaining with the readiness test and the Q-Bank questions, I created a focused review based on the 8 categories of the NCLEX. Day 1 I did pharmacology, day 2 I did risk reduction, day 3 I did physiological adaptation, and so forth. Doing this just helped me gauge where I was at the moment. Did I really improve on this area? Did I really not do well on this area? One thing that helped keep track of my scores, I created a spreadsheet on the Numbers app, which is Apple's Excel in a way. So for instance, under the diagnostic exam, my overall score was 57%. Management of care was 53%, pharmacology 71%, physiological adaptation 57%, and so forth. And doing this just helped me understand whether I'm grasping the content, whether I am getting better to tackle the NCLEX style questions. When we took the live session under phase 2, the educator said to always aim about 60% and above when you're taking these exams. If at any point you're scoring below 60, you have to be wary of that and pull up your socks in that category to do better. One thing I have to mention, don't be too fixated on the score that you get. As you can see on my score sheet, anything above 60 was in green. Anything below 60, I'm talking about 50%, was yellow, and anything below 50% was a red. That to me was a red flag. That said to me, you need to do better on this section. You need to look deeper into this section. I treated any practice test I was taking just like the NCLEX. No food, no drink, no distractions, no music, nothing. After I finished doing the focus review questions, I moved on to cumulative style questions. Cumulative style questions are questions that tests you from all 8 categories. It's not just focused on pharmacology or management of care. It's all 8 categories. And doing this just ensured that I'm just not focusing on one category for so long and forgetting about the other. When I started doing my Q-Bank questions on Kaplan, I graduated from 25, 50 questions up to 75 questions a day. I used to do 75 in the morning, review that, then 75 during the afternoon hours, then review that in the evening. I always say it's better to do at least 75 questions. It just prepares you for test retention hours, because if the NCLEX can go up to 6 hours, there is no reason why you should not be practicing to sit down for 6 hours and doing a test. In total, I think I did about 10,000 practice questions. When it came to about a month left for this cumulative part, I did not write anything down. I was focusing on just doing as many questions as possible. However, after each Q-Bank set of questions of about 75 questions, I went back, reviewed through all the questions, just reading the rationales. This time I'm not writing anything down, and this was faster and efficient for me at this point, because I'm reaching burnout at this point and just about to put all the books down and saying enough is enough. I'm ready for this test. When you get to this point, you don't even want to do much. You don't want to continue, but you have to push yourself. So now I have about 2 weeks to take my NCLEX, and for these 2 weeks, I went to the content library under phase 1 of Kaplan's review, and under the content library, there's something called crucial NCLEX content that you must know. And each video is about 1 hour long, so you have to set aside 1 hour 20 minutes to listen to the instructor. I was also taking down my notes just to brush up on some content areas that I'm like, okay, this is what I need to pay attention more. Oh, I forgot this. Let me write this down. It's categorized according to fundamentals. You can see pharmacology section, MedSurg 1, MedSurg 2, MedSurg 3, psychosocial, maternal, and pediatrics. I treated this section as my down and dirty version of you must know these things. It took me about a week to go through all the videos to make sure I understand, took some notes, and then 1 week before I tested, I took my readiness test. The readiness test, according to Kaplan, is a 3.5 hour 180 question test that just tests whether you're ready to sit for this exam. Kaplan tells you to get a score of 60% and up, and I scored at least a 69% on this readiness test. One thing the Kaplan educators emphasize on is go through the performance summary to see whether you got 4 or more questions incorrect in a row. That's not going to be a good sign. When you get 4 or more questions incorrect in a row on the NCLEX, this is the passing line standard that NCLEX gives you. So when you get 4 questions incorrect, you're basically just trending down below the line. However, if you get more correct, you're trending up above the line. And once you're above the line, you can now get each question right, wrong, right, wrong, right, wrong, so long as you're staying above the line. So that's the number 1 takeaway I got from these educators from Kaplan. One day before my exam, I told myself I'm not going to study. I put away all my books. I just relaxed. If you watched my life update up here, I discussed about what I did prior to my test day. They usually say don't study anything the day before. Take the day to relax, do something fun, and that's exactly what I did. I told myself I have studied enough. I did all I could. I have put all my efforts into this, and God is gonna come through. If I had more time to study, and if I had discovered Kaplan sooner, I would incorporate their ebook or this content review guide into my study content, because the first month that I studied, I technically just relied on Saunders and my ATI resource. The nursing educators really emphasized on find one resource and stick to it. Now, if I had stuck to my Kaplan study review guide, I would use this for my first month instead of ATI and Saunders, because it's just the same. The good thing about this book is that every single topic is supplemented with a video under Kaplan's content library. And if I had the first month to use the Kaplan, I will divide the pages in this book And for each category, like you see, I have the farm, RRP, physiological adaptation, basic care, safety. Is this safety? Yeah, safe care, health promotion, and psychosocial. So let's say this is my pharmacology section of Kaplan. I would count the pages and then ask myself, am I really okay with studying 10 pages per day? And let's say I have 100 pages under farm. You know that you're going to take 10 days to finish reviewing the pharmacology section. And then once you finish everything under pharmacology, let's say I am dealing with antidepressant medications, I can easily go to the content library on Kaplan, type in antidepressants. As you can see, when you type in antidepressants, it shows you that this is a 15-minute video. Watch that. The good thing about these videos, at the end of the video, you always have a practice question. So let's say you finish watching and then at the end, they give you a practice question and it's interactive. You get to choose the right answer. Once you choose your answer, they continue the video to explain which was the correct answer, why is that the correct answer. They basically give you a rationale. After I have finished going through all the medications under pharmacology, I will then use the focused review that I created on my QBank and do a 75 question test to test my knowledge on all the pharmacology that I have studied. And I do the same for all the other categories. And please don't forget to remediate and read the rationales. I cannot stress this enough. So for me, being that I did not work, I was just in the house full-time, I used to curate one day for testing, the next day for writing rationales and remediating the test that I did prior to that. Then in the morning, before moving on to the next item, I used to just go over my rationale notes just to make sure that I grasped the content even more. I will reread the rationales that I wrote when I was remediating the day before and then move on to the next chapter. Okay, I guess that sums up everything that I used to prepare for my NCLEX and passed with 60 questions. Good luck if you're studying for your NCLEX. Just know that you got this. Don't focus too much on what you get wrong or the score that you get after every practice test you do, because it's not going to help. All that matters is, are you grasping the content? Are you understanding how to answer these questions now? I hope this video was helpful. Stay tuned for the next video and I'll see you then. Okay, bye.